Hello, this is Kathy Sokol, and I'm going to show you how to create a simple Excel electronic health record. Creating an Excel electronic health record for nursing simulation is easy. Electronic health records are the medical norm for patient documentation. You want to make sure yours is easy to read, simple to complete, cost-efficient, space-saving, and can be modified to each patient's scenario. Also, your pages can be arranged as desired. A sample Excel EHR has patient history and review of systems, provider orders, diagnostic testing, imaging, cardiovascular telemetry, and a medication record. Optional pages that you can include are the Braden Skin Assessment Scale, Risk to Fall Assessment, Activities of Daily Living, and Nurses' Narrative Notes. For our sample, I have Margaret Sanford. We're going to start on the first page with the history and physical. There are many examples on the web to help you create an authentic H&P for your scenario. I've provided one example below. Your H&P will go over the review of systems, just like you would see in a provider's note in the hospital chart. These are provider orders for Margaret. The provider order page is where you give basic or complex instructions for patient care depending on your simulation outcomes. Typical provider orders are diet, vital signs, activity, labs to be collected, diagnostic testing to be performed, if applicable, special devices such as a pulse ox, SCDs, TED stockings, and a medication list including IV fluids. Find excellent resources for providers on websites like NIH and the CDC. Other good sources are highly ranked medical schools like Johns Hopkins, Mass General, and Northwestern University. This is the lab result from Margaret's diagnostic testing. The laboratory page should include the name of each test on a separate line, normal range of each test according to the resource used. Not all labs use the same parameters. The patient's values and your abnormal values can be highlighted in red for simplicity. If there are a lot of labs ordered, separate each type: complete blood count, basic complex metabolic panel, arterial blood gases, etc., to make it easier to assess, and I did that on my page here. Any current peer-reviewed laboratory manual for nurses can provide normal values for your patients. Patient values can be researched with your diagnosis and treatment that you found online. This is an example of Margaret's chest X-ray. Reviewing patient images on the EHR can be overwhelming to learners. Review provider orders you find online for a patient similar to the one in the simulation. If you have personal access to patients' charts in your clinical site, you can use those. However, remember you must have permission to look at the patient's chart if you're not their nurse. Once you determine the image for the EHR, you will need to include the name of the test ordered, the visual image of the test result, and the radiologist or specialist report and impression. Keep these simple. A great resource for all imaging is the website The Radiology Assistant, and I provided the link. This is Margaret's EKG. Search Google for the test you need for your simulation or use one that you've copied with permission. Downloading is easy. Save the image to your computer, then transfer it to the Excel page. Select only clear images and make sure each line is visible. The learner should be able to take out their calipers and measure the intervals. Use crisp images. Make certain each line of the EKG is intact. Remove patient identifiers if present. and include an impression at the bottom of the page. Again, keep this simple. A great source for EKGs is below the ECG library. Here's Margaret's MAR, Medication Administration Record. All simulation scenarios include an MAR, regardless if the learner is expected to administer the medication to fulfill an objective. The drug record helps understand the course of treatment for the patient. The EMAR includes the patient name and allergies. Note NKDA if the patient doesn't have any allergies. Each prescribed drug is listed on a separate line with the drug name, dose, route, and frequency. Additional info can be added if required. For instance, if a drug is for a specific problem, only as you see on the sample, such as acetaminophen for fever or promethazine for nausea. There are 2 or 3 columns for administration times. If your facility uses 8-hour shifts, create 3 columns. If 12-hour shifts are the norm, create 2 columns. Label the columns for 8-hour shifts: 0700 to 1500, 1500 to 2300, 2300 to 0700, or whatever time frame you use. Label the columns for 12-hour shifts: 0700 to 1900 and 1900 to 0700. At the bottom of the page, have a space for the nurse's name, title, and initials. You can also add a legend for abbreviations used when the drugs are administered. For instance, the acceptable IM and sub-Q sites. The learner adds their initials in the appropriate time column when they give the medication. The example below shows where the nurse initialed after giving the medication. And students can do this directly on the form on the computer during the simulation. These are some added sheets you may not always use. This is a Braden scale for Margaret. All hospitals and long-term care facilities require a daily Braden scale for each patient. Get the learners accustomed to completing this document when it's appropriate for your nursing simulation. Here's Margaret's risk to fall assessment. The risk to fall assessment is another required document nurses complete daily for all their patients. If appropriate for the nursing scenario, have the learners complete this form for their patient. This tool was provided by Johns Hopkins Medicine. This is Margaret's ADL checklist. Activities of daily living checklists help the caregivers determine how much assistance the patient requires. While most nursing scenarios don't require this document, it can come in handy for long-term or home care nursing simulations. This sample was courtesy of pbs.org. If Margaret needs nurse's notes, simply add a blank Excel worksheet in your electronic health record. At the bottom, you can title it Nurse's Notes. All nurse notes should have the date, time, and the learner initials. Creating an Excel EHR is labor-intensive at first. Once you learn the process and have a list of resources, the project moves smoothly. Have fun with it. Include the faculty when you create these records to ensure the learner objectives will be addressed. Please feel free to contact me at sokolk2@gmail.com for any questions or comments. Sign up for my simulation newsletter at ksokol.com. Thank you.